Hello and welcome all of you to the second session of the certificate course in integrative medicine, batch 3, organized by the Department of Integrative Medicine, NIMHANS, and S-VYASA Yoga University, Bangalore. Today, we have Dr. Nagarathna with us. Dr. R. Nagarathna is actually my yoga guru. Dr. Nagarathna is MD Medicine, MRCP UK, and she is a chief yoga therapy consultant at the S-VYASA Yoga University. She has more than 40 years of experience in treating patients suffering from various non-communicable diseases, including severe diseases such as cancer. For last 40 years, she has been using integrative medicine in more than 300 bedded hospital in Arogya Dhama, where under one roof we see yoga, Ayurveda, naturopathy, acupuncture, physiotherapy, and different traditional systems coming together with the modern medicine. Dr. Nagarathna has also published extensively in the area of integrative medicine, uh, and especially the application of yoga therapy. Her major publications are in the area of asthma and diabetes. Her publication, an RCT that she published on type 2 diabetes and yoga, it was a pan-India study which was actually recognized by American Diabetes Association, and she was awarded for it. So it is indeed our great pleasure to welcome Nagarathna Didi on this platform, and we look forward to learning from you, Didi.
Thank you, Hemant.
Yes.
Wish you all the best. Welcoming all of you in the month of June, which is the month of yoga celebrations, which has already started in different parts of the world, which will be culminating on 21st June, which is declared as the International Day of Yoga. And we are celebrating the decennial year of that. Friends, I am told by Dr. Hemant that you are all having different streams of medicine. You are all graduates in different streams, majority being the BNYS, BAMS, and MBBS students, and one Unani student also. So welcome all of you to this course. We had a wonderful welcome by the senior most faculty who are very, very keenly involved in making this happen. It was a Herculean task to promote this through NIMHANS and S-VYASA together. And we are happy that you are in this course, which is going to make you holistic doctors. Friends, what we are going to do in the next 35 to 40 minutes is to make you run through the program and through the conceptual basis of yoga therapy, which is the most important thing that should help you to look at every participant. We don't call them patients, every participant to be able to look at themselves as a healthy individual. Health is normal, ill health is abnormal, as all of us know. World Health Organization defined health as a state of well-being at the physical, mental, social, spiritual, and emotional level, and not mere absence of disease. If plague and cholera of the 19th century was replaced by heart attack and cancer, all NCDs are on the increase. Today, we call all these non-communicable diseases. Somebody can mute yourself, somebody's voice is disturbing. Can you meet all the participants, Hemant? So, what do we call all these non-communicable diseases today? With 40 years of research or 50 years of research in medical science, we today know that starting from head to toes, these are all called as lifestyle diseases. Lifestyle, junk food we say, lack of exercise, bad habits, like today what we see is a major bad habit is the screen addiction, and sleeping at the wrong time, eating at the wrong time, eating the wrong time of food, wrong type of foods in the wrong way, and bad habits like smoking, drinking, etc., drug addictions, and stress. Today it has become a fashion for all participants to come to you and tell, oh, my doctor has told me that all my organs are okay, but my problem is stress. I have a stress problem. Stress has become a fashionable disease now. Whether it call it as a fashionable disease, acceptable disease, we know that that is the cause of the problem, which is to be controlled by our mind. So what do we do with the mind when we see a participant as a bachelor trained or even super specialty trained medical professional? We say, oh, just now I met a participant before I came to talk to you. Doctors have told him that your problem is all in the mind because all your organs are okay. We have looked at all the organs. He says, what do I do with my anxiety, doctor? We can give you medicine, but how long should I go on taking? We don't know. This is the status of the present day medical practice, where we have proven with such a detailed investigations, detailed studies, large number of laboratories around the globe. We have shown that it is lifestyle. We are trying to propagate behavioral modification through lots and lots of media promotions, but still all the NCDs are on the increase. So we know that the root is in the mind. Diseases are all sitting on the branches. So what is it that we have to understand? Is there any remedy that we can offer at the root cause of the disease, which is the mind? For that, we have the knowledge of yoga and Ayurveda, which gives us, and all most of the so-called alternative therapies, which Dr. BNG wants to call it as primary therapies, include this lifestyle modification, mind management, etc. So this huge knowledge base of yoga, which dates back to more than 5,000 years, is the one which started with the question, what is mind, what happens in the mind, what are the functions of the mind, how it affects the body, what is the relationship with the mind and the body. Bodily problems become secondary. Primary is the mind, is what is the whole of search that has been going on. So let us quickly try to understand the definitions of stress. According to modern science, what do we define? We define the stress as not the situation, but it is our response to the situation. If it is a physically demanding situation like a big accident or a mega infection, or the hormonal changes that happen in the pregnancy, all these are short-term challenges. To these challenges, we respond with a stressful mode, which helps us to cope up with the situation very well. So, short term acute stages, stress response is a useful nature's helpful mechanism to cope up with the challenge. But what we are facing today is not these external challenges, but emotionally demanding situations, which could be negative emotions. It could be outside, like office problems, family problems, financial situations, calamities, as we have seen in the pandemic. People who have survived the pandemic, their family relatives are still facing large number of stress challenges because of all the challenge we went through, or internal targets, or people say that, okay, I have no problem in the office, no problem in the family, but I have my own challenges. I am a very progressive, productive, successful man, and I keep targets, and that makes me work like a workaholic. That has also made me highly sensitive, etc. And so, an ambitious, successful type A person also has a lot of stress-related problems. So what is important for us to talk to our participants when we meet them is listen to their challenging situations. What caused your stress? Is it the family, office, targets, deadlines? What is the factor that is making you react to the situation? And slowly shift their awareness to me, my mind, which is a starting point of emotion. Therefore, we change the definition to the participant. They think that problem is outside. You are now going to shift it to the inside and tell them stress is not the situation, but it is your response. So on, we make them understand it may be anger, fear, worry, depression, etc. And as although we say that stress is the cause of many diseases, it is really not. It is a very, very necessary response. Say, as I told you, if it's a short-term challenging infection or injury, these responses are mandatory. It has to happen for our very survival. So not all stress responses are dangerous. They are extremely useful to cope up with challenges. But what is happening is when we get stressed up, we see all these changes. Even say, for example, there is a fire alarm that goes where we are sitting. In the first response, whether we recognize it or not, is the psychological response of fear or anxiety. And then it percolates into the body, which makes you run and fight or fight with the situation, which needs all these physiological changes. So the first part to get the input, perceive the stress and respond is by increasing the limbic emotional cortex. From there, electrical currents come down to the hypothalamus, which is the stress button, which triggers off the HPA axis, which may work on all the organs. As it happens in modern life, where too many of these demanding situations psychologically, it leads us to high sensitivity. So what happens is, if we do not allow the system to regain its normalcy, then it gets stabilized, and that is the reaction pattern. So what is stress according to our understanding? There is too much of activity and very little rest, and this is the imbalance which is causing the problem. So when this gets stabilized as a chronic stress, an imbalance is created and that percolates into the body, and we see all these diseases as psychosomatic diseases. So we have we have to really, really work a lot on the entire situation. To change their lifestyle by changing their diet, helping them to come out of their bad habits, do a significant amount of acceptable, non-dangerous physical activities, and help them to understand their mind, understand their stress, and use techniques which the sages have handed over to us with 5,000 years of research. So two important concepts we download from the scriptures. One is called the Panchakosha Viveka, and the other one the definition of stress according to yoga. So what did we analyze? We said it's all in the mind, but what is it that we are doing in the mind? We all have two components of our mind. One is the superficial mind, which perceives danger and produces an emotional reaction instantaneously. And once you have perceived, analyzed, they put it into memory and create emotions. And long-term memory store is the one which is help us to create the response pattern. So what do we understand? It's all long-standing, persistent negative emotions which percolates into the body through psychoneuroimmunological methodology to cause health issues. So we have to really basically help these participants to recognize this first. How am I recognizing perceiving the situation? How am I reacting? There are three ways I can respond. One is situation you perceive, immediately somebody insulted me, I shouted. This is the first response. But as educated people, as etiquette people, not all of us can afford to express our anger, express our anxiety. So we suppress them. Kartum, to react, akartum, suppress our emotions and don't show any response, which is the root cause of all the excessive overwork on the nervous system, and response to change the response pattern. Kartum, akartum, anyatha kartum. To react, not to react, and suppress or change the response pattern is the freedom that is inbuilt within us. And that is what we have to teach them to learn to get out of these negative emotions. So, this is another very, very important concept from yogic philosophy, which we get from Taittiriya Upanishad, which says they are not only the physical body. Who am I? I am this, we show. This is the physical body. How is this different from the dead body to a living body? My dead body also is like this, but it has no function. So, what makes every cell carry on its physiological functions is the life energy, which we call as prana. So, physical body, prana body. Prana system itself has a very detailed physiological connections. So, for you and me to understand as medical professionals, let us remember this as a bioenergy which reaches every cell, every moment, and to keep us alive. It's why we say when somebody said his prana is gone, prana has left the body. So, how it lives is not the topic for today's discussion, but let us understand that prana enlivens every cell and it has got its own self-regulatory mechanism, programmed prana supply, whichever organ we want to work on, whichever organ we want to use. If you use more of brain, you send more prana to the head. If you want to do physical activity, you demand more prana, more blood flow, more muscle tone, so you send more prana to that part. If you want to run and jog, send more prana to the lower limbs. If you want to eat well and digest, you send more prana to the digestive organ, which improves it, which is necessary to carry on the activities in that part. So, behind prana or subtler than prana, more functionally stronger than prana is the mind or the manomaya kosha. I have to decide to improve the brain work. I have to decide to eat and digest the food that I eat. I have to empty the bladder. So it is all the I, the mind, which is the first foremost thing, which perceives response, perceives response. So this is the thinking apparatus. The thinking apparatus has got two components. The lower mind called the Manomaya Kosha. Behind that is the knowledge mind or the Vijnanamaya Kosha, which is a storehouse of all our memories, all our right and wrong knowledge that we have learned from our childhood. And the I, the doer. So I, the doer, has the right knowledge of what is right and wrong. And I have the control over my lower mind. In that example, a mother goes to, mother is extremely anxious when the son goes to write for the exam. What is happening? Anxiety in the mind is making her get a palpitation or butterflies in the stomach or even diarrhea. But her inner mind says, the Vijnanamaya Kosha says, your anxiety is not going to help. Keep quiet, rest your mind, wait until the sun comes back and tells you how he has done. Why are you going on rewinding that anxiety? So that is the function of the inner mind. And subtlest of all our existence is the Anandamaya Kosha or the bliss body. The best example is the state of deep sleep. When you are in deep sleep, slow wave sleep, what is happening? Your mind is totally quiet, rested. That is called as Anandamaya Kosha. So, what do we understand? We understand that all these are subtler and subtler aspect of my existence, and the subtlest is the blissful quiet state, which when operated maintains a healthy balance of the entire mind body complex. So what is happening during stress? During stress, we are working with the emotional, negative, long-standing, chronic emotion, is it not? So during that stage, here comes our sage Vasishta, who asks you a simple question. My dear child, please tell me from your own experience, your own introspective observation, what is happening in your mind when you say that you are very anxious, when you say you are very angry, when you say you are very frustrated, in your negative emotions, what is happening in the mind, your thinking. It's all thinking apparatus. What is thinking? Flow of sentences in the mind. So what are the sentences in the mind? When the girl lady becomes anxious, my boy has come to the exam. Will he do well or not? What if he does not do well? He may not get his desired seat in medical college. These four thoughts are the ones which helped her to help him for the exam. I had one student who was an extremely smart girl, very intelligent. Outside the exam hall, she would help all the boys and girls. Oh, ये क्वेश्चन बंद रहे मत ये क्वेश्चन क्या करना है ये क्वेश्चन को क्या करना. She was able to remember everything and help the co-student. But she enters the exam hall and she becomes totally blank and she failed in one of the exams, got into deep depression, came to us. So what was happening in her mind? Oh, exam. What questions would be there? Will I do very well or not? Will I do very well or not? Will I do very well or not? What if I don't do very well? Will I get the answers right or not? Anxiety built up. So what the sage is asking you to tell us is what exactly is happening in her mind when you say that she is extremely anxious, which has made her blank. Can you think of that? I have to face this exam. I should do very well. What if I don't do very well? Was helping her. But now as she is inside the exam hall, what is happening in her mind? क्या होगा क्या होगा क्या होगा क्या होगा? What will I do? What will I do? How will I cope up with this? Will I do it well or not? Same thoughts picking up enormous speed is the whole of the problem which makes her get locked up. It's like a fan which gets into deep whirlpool. We can't see the moment she blanked out. So this is the most important component of your understanding. Mind, body is controlled by the speed of the mind So how do we define stress according to yoga? USST, please note this, uncontrolled spinning speed of thoughts in the mind is the definition of stress according to yoga, USST. So this USST increases the brain activity, increases the prana activity, and that is what is beautifully explained in this sloka in Bhagavad Gita. So in all these emotions, kama, krodha, lobha, moha, mada, matsarya, which the sages called as negative, disturbing emotions, we are going through this speed, which releases all your stress chemicals and creates all the problem. So what do we understand? There are externally challenging situations, internally challenging situations to which we react, and produce enormous amount of speed which percolates into the body over a period of time and settles down in the Annamaya kosha or the physical body, causing inflammation. What have we understood in with 40, 50 years of research in all these NCDs, which are all on the increase to reach pandemic proportions. But the research has clearly shown us the whole mechanism of what happens in the chemistry, neurochemistry, neuroendocrinochemical system, which is causing the problem, so that we are able to find drugs to counter that or increase the required chemicals. That the end point. But we still have to work on the mind. So what is the summary? USST at the mind level, uncontrolled spinning speed of the thoughts in the mind, which is creating a lot of excessive prana activity, pushing it to the physical body, Annamaya kosha, where it settles down as a inflammation. All NCDs, even obesity today, we know is inflammatory disease. Diabetes is an inflammatory disease. Hypertension, inflammatory disease. Coronary artery disease, an inflammatory disease. All diseases are inflammation. Inflammation is violence, speed. So speed at the mind, speed at the prana, speed of the body is the problem. Therefore, we should work on reducing the speed, developing emotional stability, and change our response pattern and recognize that freedom which is inbuilt within us. We already have the inbuilt capacity. Yoga is not doing anything which we don't have within our capacity. We just have to recognize that it is all violence and speed and learn to slow down the mind. So yoga by definition is this. Manaha prashamana upayaha. Yoga is slowing down the mind. The technique to slow down the mind is one of the definitions. I request you to remember 3 definitions of yoga. One is this prashamana upayaha, slowing down trick. And through that, we get deep rest to the system, and that rest is the healer. So the first thing that we have to understand when we start teaching yoga is, or when we understand what is it that heals is deep, conscious, wakeful rest to each and every cell of the body, more so to the sick part of the body, where the uncontrolled spinning speed of prana is locked up, and therefore we have to heal the system by giving deep rest. You know that most of the participants who have psychosomatic disease have sleep problems. Why? When they don't get enough sleep, no deep rest, so the disease gets aggravated. So 2 major things. Every participant, I request you to ask as soon as you start talking to them is about their sleep and clearing of the bowel toxins stuck in the constipation. So deep rest to the mind-body complex is the healer. Everything is vega, vega, vega. Reduce the vega, reduce the vega, reduce the vega, and give deep rest to the sick organ. That is reducing the inflammation, and that is what is the healer within. So we have these deeply restful practices, which we call as DRT, deep relaxation technique, short-term 2 minutes instant relaxation technique, 4 minutes peak relaxation technique, 20 minutes cyclic meditation, 20 minutes of Om meditation. All these help us to give deep rest to the system. Through this slowing down, we come to the second definition of yoga, which is MMM. By Prashamana, we get mastery over the modifications of the mind, or the mastery over the monkeying of the mind. What is the monkeying? USSD, uncontrolled speed. So slow down, slow down, slow down. Mind slowing down, trick Prashamana, you get MMM. You get to the mastery. So welcome Krodha, bye bye Krodha. Welcome anxiety, bye bye anxiety. Welcome distress, bye bye distress. Can we do that? No. We get stuck in that speed. It goes on and on and on. And many times we don't recognize at all, particularly type A personalities. They don't recognize that they are stressed. So the third definition of yoga by Krishna in Bhagavad Gita is Samatvam Yoga. Samatvam, balance, balance, balance. What was the problem? Autonomic imbalance, hormonal imbalance, psychological imbalance was the problem. So restore the balance is yoga. So I repeat, MMM, mastery over the modifications of the mind, by MST, mind slowing down trick, to reach Samatva is the principle of yoga therapy. Easily said than done. So in all these lifestyle diseases, we have to work on the mind so that they get mastery over their diet, mastery over their physical activity, come out of their bad habits, and I manage their stress. So easily said than done. We all need techniques, techniques, techniques. Sages gave us hundreds of techniques over 5,000 years of research and told us that these are all the techniques. Healthy, simple yogic diet, detoxifying Kriya techniques of Kriya, physical asanas, pranayama at the prana level, dharana dhyana at the mind level, emotions, culture, the mind level, and notional correction of what makes me happy, who am I, all these concepts we have to work on, and we introduce this to help them to stay in that blissful internal silence while at work also. This is the whole of the holistic approach of integrated approach of yoga therapy. So in all your participants, first make them understand that you're not going to treat their joint or the back or the heart, but tell them, I'm going to treat you, my dear friend, starting from head, mind to the body. So we have several techniques, as we said. In the diet, we have got sattvic diet, which is what the sages did was they classified all foods under three major categories, depending on what is the effect of food on the mind. All that we know in our understanding of diet is that vegetarianism, non-vegetarianism, all this we talk. And in vegetarian also we talk about the protein, carbs, etc., fiber, etc. But the sages talked about the effect of food on the mind. So simple, sattvic, wholesome, vegetarian, timely, regular, homemade food is the one which is very, very important. And then physical exercise, exercise to burn out calories, exercise to build up the muscles is very, very essential. There are a large number of studies on the effect of exercise, both on mind and body, to prevent lifestyle problems. But in yoga, what we do is we add on the dynamic yoga as an exercise, because yoga not only works on the body, but it works on the basically on the mind. Then cleansing techniques, many cleansing techniques. Then comes the asanas. What did Patanjali tell us about the role of asana? Say, for example, I had a participant. He was a sadhu, sannyasi, very genuine senior sannyasi. He had diabetes, obesity, and ONEs in his 50s. He comes here. But we told that, I just now told you, it's all deep rest at the mind level, freedom from stress, freedom from agitation, which is a healer. This Swami is doing 3 hours of meditation every day and he has nothing to complain of, happy person. Then why does he have all these problems? When he came here, he got cured of his diabetes, stopped all his medication, reduced 20 kilos of weight, and was able to manage his knee pain also, walk around and all that. What did he understand is, what I used to do was, I de-identified myself from all the imbalances at the body level, took off into my manomaya kosha, took off into my vijnana, and stayed in anandamaya kosha and meditated for 3 hours. But now what I understood was, these imbalances that were stuck at the body level, I have to enter into that sick part of the body, and for that I need to do a movement of the sick organ, put my mind there, focus my mind there, defocus from there, depress to that part. In other words, I have to meditate from the sick organ to go to that Anandamaya kosha. If it is stomach, I have to develop an awareness of the stomach area by doing asanas, put my focus there, then from there do Prayatna Shaitilyananta Samapatti, or relax and diffuse and give conscious, wakeful, deep rest. And that is how I could cure myself, he says. So we use asanas. At the pranamaya kosha, we use pranayama, create pranic balance. So what is the principle of pranayama? Slow, deep breathing, mastery over the excessive speed, balancing of prana that reduces the sympathetic tone. So directly working on the mind is the most important thing, because that is the starting point. So we have developed doable type of meditative practices, because patients are agitated, patients are in a state of deep turmoil. If you ask them to sit and meditate for 2 hours or 1 hour, their mind doesn't listen. Even you and I, if you want to sit for keeping quiet, chant Om, and go to very slow mental state, which can switch off in course of time, is mind, because mind was USSD, slow down, switch off. But how can they do? Because my mind is uncontrolled speed. Therefore, we have to design meditative techniques which involves body movements, which involves breathing movements, which involves chanting movements, and through that help them to slow down the rate of the program. And Bhakti Yoga is that emotion management technique where we have to replace all our violent emotions by soft emotions and work on that. And we explain to them the concept of happiness, and through that we teach them to go to that deep internal silence. And yoga stha kuru karmani. What is karma yoga? We are all working. There shall be a layer in your inner compartment where you are always established in silence, and the work goes on in a very harmonious way. So when we have to do as medical professionals, what is your job? You have to add on this holistic approach to all participants, whether it is a BP participant or cancer participant. You have to push them into that internal stability, silence, harmony, calmness. For that, we have to know how to select the specific asanas, specific pranayamas. But remember, you have to include all components of yoga, the asana yoga, breathing yoga, meditative yoga, intellectual yoga, physical yoga, cleansing yoga, devotional yoga, intellectual jnana yoga, and work yoga, karma yoga. Swami Vivekananda said, the goal of life is to manifest this divinity within by controlling nature outside and inside, by do this either by work, karma yoga, worship, bhakti yoga, psychic control, raja yoga, philosophy, jnana yoga. Use all of these. This is very, very important for you to know. As soon as some participant approaches you, they'll ask you, what asana I should do for this disease? You immediately take them to the concept that it is not one asana that helps you, but it is the effect of the asana, effect of the pranayama. We have to work at all levels. Is the major concept that you have to work on. So, the next few minutes, I'd like to quickly share some concepts, some research data, unless you have any specific question. This was a study in our collaborative study at the MD Anderson Center, which is the biggest cancer center in Houston, Texas in America. We are collaborating with them for last 20 years. Breast cancer participants, we pick up very simple modules and help them document the data before and after the 3 months of therapy. We're able to show better general health parameters in the yoga group as compared to the non-yoga group. Physical functioning was better. Benefit finding was better. Intrusive thoughts were reduced. And in our Indian scenario, we added yoga on the day one of diagnosis of cancer, when the lady will be extremely anxious, frustrated, fear of death. They are in a great turmoil, both the patient and the family. So we have to work with them even at the starting point, that you have the enormous capacity inbuilt within you to heal yourself, to cure cancer also, by giving large number of conceptual ideas and allay their anxiety. And we followed them through the surgery, through radiation therapy, through chemotherapy, until they completed, went on giving them inputs at all the levels. And these were the results which showed significant. All these are published reports in PubMed Index journals. You can go through that. Mean toxicity scores after chemotherapy was much lesser in the yoga group. Hospital stay after surgery was much less. Asthma was the first disease which we published in 1985 in British Medical Journal, where we were able to show the medication requirement coming down significantly, both oral medication. Those days when we did this study in 1980s, people were not yet used to inhalers, but mainly oral medication was the therapy. We were able to show the reduction in significant, and this was the data we published in British Medical Journal. Even the AGE levels reduced. We did also the skin prick test and showed that their sensitivity to the allergens was much less after yoga. In cardiology, we did a post-CABG study, randomized control study, and this data that I'm showing is what happened within 1 year after study. after introducing yoga to CABG patients who were admitted. But today we have 10th year follow-up. In the 10th year follow-up, we are able to show that the survival quality of life was much better in the yoga group after CABG. Multiple sclerosis, we work with another institution in Germany, which is a neuro rehab center for patients with MS, and we were able to show in one of the studies they're all wheelchair-bound participants. We teach them very simple practices and help them to understand how much mind can work on that. And we were able to show in these participants their urinary incontinence was much less after yoga, which made them sleep better. Every day in Prashanti Kutiram, our campus, where you will be visiting for a week, is a miracle day. Yesterday, I discharged one participant who was totally disabled and he got completely cured of his disability. Yesterday, I met another lady who told me I brought my husband 10 years back, and now his knee was completely fixed. He was crawling on the ground, but within 3 weeks, he got completely over. He could walk, and now he's happily walking around, etc. So every day there is a big miracle that we see in our campus. Autism children is another area where we have worked, another PhD student study where we were able to show these changes. Diabetes is another major area where we have worked, and as Hemant said, we were awarded for this study on nationwide Stop Diabetes movement. So let me stop here, my dear friends, and take some questions from you if you have any. It goes on and on. Go to our website. You can see all the papers that have been published, both in understanding the physiological effects in normal healthy volunteers and also in sick people. Let me stop here and take some questions if you have any.
I request students to kindly unmute and ask question. This is a very unique opportunity to ask question to the world-renowned yoga expert. So please unmute and ask.
Can I ask?
Yes, madam.
Mm.
You are
I just wanted to
Nina.
know, how do we practically start with a patient who is having a lot of anxiety? If I tell them that you have to control your mind, they might not understand it.
That's where you first take 5 minutes of your time to explain to them this concept of uncontrolled spinning speed of the mind and how to reduce the speed of the mind by using breathing. You take 5-10 minutes to make them understand that anxiety is also because of uncontrolled speed, and you have the capacity within yourself to reduce the speed, which you have done several times, many times, and sometimes you can't. Having said this, I'll teach you techniques of slowing down. First, shift the awareness from the head to the breathing. Shift, shift, shift. In front of you only you can make him do little bit of brisk walking and slow breathing, fast breathing, slow breathing. What I tell people if they're very anxious is, no, come, come, come. I won't talk to you much. I'll talk to you after I tell you what to do. Breathe out. Your anxiety is stuck up here. You blast it out, blast it out, blast it out, blast it out. Anxiety out, anxiety out, anxiety out, anxiety out, anxiety out. I count the number of 1, 2, 3, 4, 20 times, and then make them sit and recognize. Now slow breathing, chant one Okara, then I'll start talking to you. You get the immediate change in their capacity to handle themselves. And so these are all techniques. What we have done is, we have developed modules for each disease. Yoga for hypertension is different. Yoga for back pain, totally different. Yoga for obesity, totally different, based on our physiological understanding. So you pick up simple practices, build up upon it. Most important
Thank you.
thing is for you people to experience that yourself. Unless you are convinced that it can help your anxiety, you will not be able to help others. Isn't it?
Yes.
Can I ask question, madam?
Yes. Yes, please.
Madam, you were speaking of this panchakoshas, and then from one particular kosha to how to go about this getting into the koshas. Like you said, we have to get into the pranamaya kosha and then from there into other koshas. How do we do that?
You teach them, you make them understand about prana energy. But what you do is to work on that breathing itself. You make them understand prana is the life energy which is making you take in oxygen and breathe out carbon dioxide. So it is the physical body which is expanding itself to receive the oxygen and throw out the carbon dioxide. That energy that makes you breathe is the one. When you are anxious, your breathing becomes more, prana is more. Therefore, you start with breathing, which is the pranayama. And it takes a long time before they can perceive the actual prana, but that doesn't matter. Using a breathing from your understanding that you are slowing down the prana by using breathing is good enough. But once they experience that mind calming down, that is enough to start with.
Thank you, madam.
Can I ask a question?
Yes, please.
It's very difficult to disassociate binge eating from anxiety. And in spite of practicing medicine myself and being a diabetic, many a times I indulge in binge eating or just grab something when I'm anxious, and it actually relieved my anxiety. So how can I tell these patients, or rather myself, to control this binge eating or carb cravings to control anxiety?
As that's the reason why we have so many other techniques which does not expect you to immediately change your craving for eating. Craving for eating junk food also can be controlled if you calm down your mind. It is the mind which is making you munch, mind which is making you eat so much. So if you can calm down the mind by, in fact, if there is something which you can't touch at all, leave that portion alone for some time, work on other parts. So if he is with you to do his physical yoga, more of physical yoga, so that your energy gets dissipated, not through. You said something very important when you asked your question. When I ate, I felt comforted. So
Yes.
that eating is giving comfort because you have spent your energy at the eating level. Instead, you do it at the jogging level, playing level, and then eat, so that the rush and speed of the mind can be controlled. In fact, you don't even talk about asking them to stop eating. As soon as you start giving this integrated approach, introducing the breathing exercises, asanas, pranayama, cleansing techniques, done with the understanding that I'm slowing down my mind, automatically you'll be able to help them to come out of their craving part after 3 or 4 sessions of training.
But they sometimes pay me that if I get off all the stuff that attract me, or if I just live in the absence of these temptations, that will help. And how to, it's very important and it's very difficult to stay away from temptation. How can we tell the patients or even myself to stay away from temptations?
That's why don't talk about that at all to start with. You tell them it
Okay.
is not, I'm not working locally, I'm working at the whole system. It's the mind we have to work on. Forget about your craving. If you want to eat, go on eating the way you are eating for a few days, but do what I say. Do what you are going to be doing in the form of 1 hour of breathing practices, pranayama, meditation, relaxation technique. Automatically in 5 days it comes down. That
Thank you,
is
madam.
the clue given by sages. First, divert the energy, then focus the energy, defocus the energy, and merge in the deep quietude. There's a beautiful statement in one full chapter dedicated in Taittiriya Upanishad to make people understand that happiness is not in the object that we are consuming, but happiness is an inner silent state of mind. So that what we teach the diabetes participants is, you have a craving for rasgulla, okay, you purchase 1 kilo of rasgulla, distribute to all your friends. That's Sukha Sukhitam.
Okay.
Your happiness is my happiness. Your happiness is my happiness. Keep 1 rasgulla for yourself after you have had your high fiber diet. Then sit in the meditative state alone. Take a small piece of rasgulla, put on your tongue. Aha, experience. So eat 1 rasgulla in 15 minutes, and that gives you much because you are doing it with awareness. Crunch.
Okay. Thank you.
Okay, sir. Yes, madam.
Yeah, namaste, madam. Thank you so much. It was a beautiful presentation. My question is also, as I practice, I have seen that there are some people, we focus so much on weight, obesity, like the body focus has become more in the Western world. Partially it's good, partially it's bad.
India is
Huh?
not different. India
Okay.
is not different.
India is no different.
So the thing is, what I see also the opposite effect is also bad. I see here when we are into spiritual practice, I go to ashrams and I myself am doing a lot of learning. But as you said, the body, we tend to neglect the body as we are into learning, like, spiritual practices. So how to change the focus on the body? Because as we are learning many of the spiritual books, I don't know, we might have understood it wrong. Like they say body is not important, but how do we shift? In the Eastern world we have learned this, and the Western world they focus too much on the body. How do we balance this?
As a spiritual practitioner, that's why I told you that sadhu sannyasi's example. Simple way to summarize what we need to do is, you are meditating from here, but you meditate from here if you have a pain here. You meditate from here if you have a stomach pain. You meditate on the physical fat cells if you are obese. So you are not taking the spiritual practice, but just shift the point from where you are meditating. Om meditation from here, Rama meditation from the heart. You shift it. So you meditate from your shoulder if your shoulder is hurting you. Meditate from your pancreas. What is meditation? Meditation. Awareness to the sick organ. Slow. Prayatna Shaitilya Ananta Samapatti. Patanjali says. From there you reduce the vega there. From there you expand. Gives the press to the pancreas, and you'll be able to come out of your hormonal dependence.
Okay.
That
So
becomes
that means
acceptable to a spiritual practitioner. I am not out of that makes it acceptable to a spiritual practitioner, because you are not asking him to stop doing any spiritual practice. Instead of meditating from here and getting off, you do some movements, because then you become aware of that part. From there you relax, go to meditation. So Shri Ram, Shri Ram, Shri Ram will happen here. From there you go. From there you go. From there you go. So that same Shriram, same meditation, same mantra, but you have to develop awareness of the part which is sick. For that you do some body movements, for that you hold in particular postures, and from that point you take off.
Okay. So are there any audio visual help material for people to focus this way? Any books or
There
audio
are-
visual material?
There are many books, videos which make them understand.
Okay.
And back pain special technique, headache special
Okay.
technique, gastritis special technique. All these are available.
Okay.
You will be
Okay.
learning
Thank
that.
you.
You will be learning that, seeing that in your course.
Okay.
S-VYASA University has
Thank you so
developed several such practices. Dr. Nagarathna herself has developed several such practices. They are available, on S-VYASA, Swami Vivekananda Yoga publications. Also, such books are there. Also, recently I saw a book. Didi, we talk about mindfulness. There is a book by Christine Caldwell. It is called as Bodyfulness.
Okay.
So,
Very
somatic practices for mindfulness related to the body. So I think this is another very beautiful concept.
holistic approach. ಇವಾಗ new word is bodyfulness.
Bodyfulness, yes, Didi.
That's a very good one. Yeah. So yeah, I want to visit S-VYASA. I have never visited. I'm
Where
here
are
in
you?
Bangalore.
You are in Bangalore now,
Huh?
Shalini?
Yes, I am in Bangalore for
So,
next 3
I have
weeks.
shared the Google form. You can tell us which slot you have selected for your S-VYASA training, and all students, they will go in batches. So definitely you are going to visit there for a week.
Okay. Thanks.
Okay. Okay.
Thank-
So thank
Thank-
you so much, Didi. Every time I hear you, I get newer and newer insights. Though these are very simple concepts, but they have such depth. So thank you once again. It was a great learning experience. From your busy schedule, Didi, you have given us a lot of time. I am really, really grateful to you, Didi.
Thank you. I hope to meet all of you. You are all going to be the torch bearers of integration, which is the dream of BNG and Dr. Nagaraj and all of them, and our Guruji. So you are going to be the next line, and your children the following line, whereby 2047 entire world be practicing integrative medicine. It is the dream of our Prime Minister also.
Yes, Didi.
Thank you. Namaste.
Thank you, Didi.
Om Shanti Shanti Shanti.